Troubleshooters often get complaints from people who need certain medical tests or surgeries, but they keep getting denied by their insurance companies.
While we can't look into all of your cases, we spotted something recently that sheds a whole new light on what's going on. And it comes from a law student at the University of Louisville who never dreamed he'd be looking into this issue. Have you ever needed a medical test or a surgery ordered by your doctor, but your health insurance company kept denying it? I have, multiple times. After reviewing the information we have, we determined we cannot approve this request. We found the service requested is not medically necessary in your case. You know the language if you've ever received one of these. Same thing happened to Frank Bifus and his wife, who was diagnosed with a rare genetic disease.
To me, it was inexplicable how much we'd have to fight with insurance companies to get her coverage. And a lot of those fights we lost. And typically a lost fight meant she just didn't get the care she needed.
So maddening, he started researching, and what he learned prompted him to write this paper, which was peer-reviewed and published recently in the University of Louisville Law Review. He specifically looked at employer-sponsored health care plans, which cover over 50% of the U.S. population. The first thing he certainly thought would be verifiable is how often claims are denied. How often are claims denied?
What I was able to find is it's really not known how many claims are denied, how often claims are denied. But the simple answer is everybody thinks somebody else is doing it, and no one is empowered to do it, essentially.
That's right. No entity tracks the prevalence of health plan claims denial, he wrote. The lack of monitoring makes the prevalence of wrongful claim denial impossible to know. The Centers for Medicare and Medicaid Services is the only entity that tracks claims, and it denied over 18% of in-network claims.
If you look at the Medicare and Medicaid data on denials, it approaches and varies year to year, but less than 1% of those claims are appealed, it seems, the denials anyway. And out of those, about 70% of the ones that are appealed are eventually approved. And I think a lot of it's just people, it's just throwing up roadblocks. They know they get so many free roadblocks. There's no reason not to throw up roadblocks. They can delay people from getting care, and a lot of people just are going to go, well, I guess I don't get that. I guess that care is not for me.
How many roadblocks? In most states, you can appeal internally twice. Each one can take months to process. Then he says you can make an external appeal handled by a company that is hired by the insurer.
If you go through all those steps, then you can go back and say, you are wrong, I'm going to take you to court. But there's really there's very few attorneys who will handle those particular kinds of cases.
So you're just out of luck?
You're mostly out of luck, yeah.
Your health can worsen during the wait, and even if you ultimately prevail and you then try to sue, he found you would recover with near certainty $0 outside the cost of the originally denied care.
Insurers of these group health care plans are immunized from all kinds of different damages that normally, those are the monetary payments, the punishments essentially, for acting badly.
Cloaked in the safety of legislation and precedent, he found, insurers can avoid covering claims because the penalties for breaching their duties are far cheaper than performing them.
The only punishment for stealing in these cases is having to give back what you stole, sometimes.
Even the doctors that insurers hire to determine if a claim is medically necessary have consulting physician malpractice immunity.
Your doctor goes, he meets with you, says, John, I think this is, after meeting with you, after taking your vitals, after seeing how you're talking to me directly, knowing you for years, I think you need this. If that doctor makes critical errors or doesn't meet their standard of care, they're exposed to medical malpractice liability, and that can be pretty severe. Conversely, the doctors reviewing your insurance claims are not treated by that same standard. They don't have to meet that standard.
And it's only getting worse for consumers. Bifus found after decades of litigation and legislation, the insurer's position has mostly improved. The United States Supreme Court has upheld the insurer's interests, typically in near unanimous decisions. Bifus ultimately prevailed in his wife's healthcare denials after years of learning how to write what he calls sophisticated appeals.
Most people are not savvy when it comes to healthcare, and they don't necessarily, they've got a giant network coming at them. And what it ends up doing is it puts normal people, ordinary, everyday people, in a position where they can't get health care, and it puts doctors in the position of essentially becoming their own, insurance law firm. And that's a sort of a bizarre place for us to be.
So, what do? BIFA says appeal, appeal, appeal. Make yourself a squeaky wheel. And stay with Wave News, because I'm going to have a follow-up to this with a local company that's having success helping doctors and patients navigate these claim denials.